My name is Sue Koenig. I had my fuse procedure 1 year ago. We were in the process of packing and moving. I had socks on and I slipped and fell on a hardwood floor, and I fell and hit my right hip, and that's what started all the pain. My pain affected my life when I couldn't hardly walk and I couldn't bend over to tie my shoes, and I really couldn't stand very long. I tried physical therapy and injections for my pain. The physical therapy made my pain a lot worse. I felt a little better after the injections, but after a while the injection medicine wears off and you start hurting, and I couldn't take the pain anymore. And I went to my regular doctor and they referred me to see Dr. Laratta.
I'm Dr. Joseph Laratta from the Neck and Back Institute of Kentucky here in Louisville, Kentucky. I'm an orthopedic spine surgeon. We're going to be talking about the minimally invasive SI joint fusion procedure. Sue is a patient who's been a patient of mine for years now, who came to me as a referral from one of the primary care doctors for non-specific lower back pain. And she had seen multiple surgeons before and multiple other physiatrists who were unable to place their finger on what the diagnosis was. She is somebody that we diagnosed with sacroiliac joint dysfunction. We treated her non-operatively for if not 8 to 12 months. And it was only after she stopped responding to injections that we decided to have that discussion with her about the risks, benefits, and alternatives of the iFuse minimally invasive sacroiliac joint fusion procedure. The SI joint is a joint that connects the spine to the hip. It has some of the strongest ligaments of the body surrounding it and protecting it. When the joint does have motion is when patients present with different types of problems and pathologies that are associated with sacroiliac joint dysfunction. SI joint pain can be caused by a number of things, and we see it in a number of different patients. It could be post-infectious, it could be something that you see in postpartum women, it could be due to a degenerative cascade, and it could be due to trauma. SI joint pathology is something that is extremely common in our population. It's interesting because if you asked me this question 10 years ago, I would say that SI joint pain is very uncommon. The first practice I was in was a practice of 10 spine surgeons. All of them did spine, and in that practice, I was only one person who believed that the sacroiliac joint caused pain. If you ask those 10 spine surgeons now, 9 of them will probably tell you that the sacroiliac joint can cause pain. Studies have shown that up to 40% of patients who have back pain after lumbar surgeries, 40% of those patients can be placed into the sacroiliac joint dysfunction or pain or associated to that. The SI joint diagnosis is extremely difficult. It could present as hip pain, it could present as back pain, it could present as leg pain, it could present as buttock pain. It's not something that you can diagnose specifically from imaging alone. It's a combination of history, physical examination, but I think the most important test to determine that it's the SI joint is a diagnostic injection that's placed directly into the joint itself. There are treatment options for sacroiliac joint dysfunction and for any spinal condition or musculoskeletal condition. Only when these get exhausted do we convert to surgical management. The iFuse procedure is a minimally invasive sacroiliac joint fusion procedure that's completely revolutionized spine surgery. The procedure itself is done through an incision that's the width of my thumb, and we use 3 triangular implants to cross the sacroiliac joint and provide biomechanical stability to the joint. And the patients go home about an hour to 2 hours after surgery. I usually tell patients the recovery is about anywhere from 2 weeks to 4 weeks.
The only thing I remember about my recovery was it was a very fast recovery. I do my exercises now, I walk, I climb hills. It feels good to be outside. What Dr. Laratta did made me so happy. That man saved me and brought me back without no pain.
There are many different options for the treatment of surgical sacroiliac joint dysfunction. Probably within the last 5 years, this has been one of the most rapidly expanding industries in spine surgery. The one thing that sets iFuse apart from the other implants is the level 1 data. I'm happy that I can offer this to my patients as a solution to their non-specific back pain. Like we've discussed, SI joint pathology and SI joint dysfunction can present in a number of ways. If any of these things are concerning to you, then they're concerning to us here at the Neck and Back Institute, and we'd be happy to take care of you. Please give us a call and we'll get you in as soon as possible.